There we go. All right, cool. So, all right, welcome to Lipstick, Lollipops, and Hope. We have Kelly Seitz, right? Seitz?
Yes.
I always just, everybody knows I screw up everybody's name all the time. And Erica Pogue. And this segment is going to be, like most of mine, raw, real, and this one's about breast cancer. So these women are breast cancer survivors. And we were just talking about how it kind of correlates to some part of my life. But I met Erica at the CrossFit Squad. So thank you, Derek, another good thing that you gave me. And Erica was nice enough to bring Kelly, and she was telling me about her story. And I'm just super excited to have these conversations, talk about breast cancer and the survivor factor of it. I always kind of look up some information online before I talk about things, and it says what I found. It says breast cancer is the most common non-skin cancer among American women. Mm-hmm. And then it said in 2019 alone, 271,270 cases were diagnosed in the U.S., and we're not even done yet for this year. 7% of all cancer-related deaths in women are from breast cancer, which I thought was another interesting, sad but interesting factor. Yeah. And the most common ages were between 55 and 64 is when people were diagnosed.
Oh, wow.
Yeah,
well,
which is
we're not
perfect for us.
Age
We
group.
really don't hit that mark at all. Yeah. So there you go, America. Yeah.
And then, I talked about like different stages and things, which we'll get into. Mm-hmm. So we're doing kind of a tag team thing here because Erica's like, no, I have somebody that I want you to speak with. I said, but I want to know your story because I know you. I've seen you. Like when I heard in CrossFit, what you were going through, and then some of the things you did, and I started following. I started stalking you on Facebook, by the way. So I started, following.
First stalker.
I started following her on Facebook, and I was like, wow, like she's intriguing, she's inspiring. This is awesome. So I don't know which one of you guys want to go first. Tell a little bit about, who you are, what you do, where you came from, how you found out, and then we can kind of get into everything. Like I said, it's just everyone knows it's just conversational. It's just, hey, let's give you some information on this and let's see how you survived. So, all right.
I guess I'll go first.
Okay.
So, I don't really know where to start, to be honest.
That's always the hard part.
I know. So basically, I was at the CrossFit Squad, and I was working out, and I'd been there for a little over a year, and I just switched over actually from their boot camp to CrossFit Squad. I did the CrossFit Open, and just finished the Open. One night I'm in the shower, and I found a lump in my breast, and I was like, what the? Mm-hmm. Next day I got in for a mammogram, and then it kind of rolled from there, went through all my treatments and everything. We could get into more depth in that. Yeah. But then after treatments and everything like that, I was in a support group, and that's when I met Kelly.
All right. How did you find out your...
Well, sort of started out a similar story. I mean, what I had, I was I was 30 at the time, believe it or not. I'm actually a 12-year survivor.
Awesome.
Which is, yes, thank you. Amazing to be 42 years old and say you're a 12-year survivor. But yeah, I was 30 years old. And actually mine kind of started when I was about 28. Similar thing. I was in the shower, found something. I jokingly say I had like no risk, neither of us have family history, which is another thing we'll talk about, which most don't. Right. Which is kind of a misunderstood thing. But, I had no risk factors, no nothing. I found something. I jokingly say I barely had breasts. I was a AA naturally, so wasn't really too hard to find anything. Found some in the shower. Of course, was like freaked out. My mom said, oh yeah, I've had stuff like that. Go to the gynecologist. I go there, they give you what's kind of like a diuretic, basically. If it makes it shrink, they know it's nothing to worry about. That happened. Everything's great. And I remember that very distinctly. It was like right before Christmas. So I went along that way for about 2 years, and it gradually over time reached a point where it wasn't going down in size. It would, kind of come and go through cycles and things like that. And then it was very visible on the surface, and it was very painful, which is normally a good thing until it's really not a good thing.
Mm-hmm. So it was growing even?
It was, yes. And it just happened to be time. This was October of 2007, time for my annual exam, and with my gynecologist, and thought, okay, this is good because I've got something. This is definitely, kind of problematic. And since confirmed, a very good gynecologist. He was an older gentleman, as my oncologist likes to tell me, as we like to think, and I'd like to think now, 12 years later, we've got beyond that point. But he examined me, and he said, oh, I see that's still there. And I'm like, it's still here, and it's really painful, and it really bothers me. well, you can have it drained. You know, he was telling me it was a cyst, and I have gotten copies of my medical records of him absolutely saying it's a cyst, and you can have it drained, but they usually come back. They go away after menopause. So for people like us, oh great, all right, I'll just wait 30 years.
Hang out with that for
Perfect. So I had a friend at work who, you know, a little bit older than me, and she was going to this wonderful breast surgeon locally because she had a lot of issues from time to time, and said, you know, why don't you just go get this checked out? So thank God I, you know, took my own initiative, and not that I wouldn't have, because it was painful and I wanted to do something about this. A surgeon who'd actually also taken out my mom's gallbladder, oddly enough, but he is mainly a breast surgeon, so I went to him. First appointment I could get, like 3 weeks after I'd seen my gynecologist. Before he even examined me, here I am, just, you know, undressed, he looks at me and starts drilling me, like, how long have you had this? And I'm like, whoa, whoa, buddy, you know, I'm just doing my part here. And he's like, that is not a cyst. That's either an abscess that's badly infected or it's a malignancy. And so, from there, kind of the same thing. Got to an oncologist, and that's how it all started.
So, take me through, like, when you found out your diagnosis. Were you, what stage did they say you were in?
So I found it when.
Wait, let me go back. So there's different stages. I did that.
Yeah.
So there's stage 0, which just through research says it's the mass is non-invasive, and then it's under 2 centimeters. And stage 1 is 2 centimeters to 1 or 5 centimeters or something like that. And then
Stage 2 is 2 centimeters to 5 centimeters.
okay,
So stage 1 is up to 2 centimeters.
Okay.
And 0 is like less than 1 centimeter.
and then it says 3 is more than 2 inches, and 4 means it's metastatic, which means it's spread to other places other than the breast.
3
can be metastatic as well.
can be,
And
okay.
also even so, like for me, when I was diagnosed, I was stage 2B, which
Okay.
means that I actually had a few lymph nodes involved. So I was just, I think, 2.5 centimeters when I found it.
Mhm.
But I had 2 lymph nodes involved, and then by the time I actually got to my first treatment, it was like just over 3 centimeters. So it was a very aggressive.
Oh wow.
Uh,
What was the time frame between those two?
so I found my tumor April 6th of
Okay.
2017, and I had my first chemo the Wednesday before Memorial Day.
Wow.
So
Oh,
that went pretty quickly.
Yeah.
And I responded very well. My diagnosis was I was just HER2 positive. I was not hormone receptor positive. And there's different types of breast cancer, and you're treated differently for the different types of breast cancer. That was mine, was just HER2 positive, no hormone receptors. I know several people who are triple positive. She's triple negative. And then some people are not HER2 positive, and they are just hormone receptor positive. And so each of those, though, definitely gets a different type of treatment. And it also depends on the size. For me, because mine was growing so rapidly, they wanted to shrink it first before they did surgery. So some women will have surgery first, then chemotherapy. For me, in my instance, I did chemotherapy first. They shrank my tumor by the time I got to my 3rd chemo, my tumor had shrunk so much you couldn't even feel it. You couldn't tell anymore. It was just like amazing. The drugs worked amazingly for me. Was one of those chemo patients who actually gained weight. Thank you, Decadron.
Oh, me too. Yeah.
Oh, did you?
No, I did. Yes.
I want to get to
steroids,
that,
yeah,
but I
good
want to
times.
ask you about yours. So what stage were you in?
I'm pretty sure I was 2B as well due to the size of mine. I didn't have any lymph node involvement per se. I had some lymph nodes that were enlarged, but they never actually tested positive. They sort of showed up a little bit
Then
on
you should have been 2A.
PET scan. I know, but I think they say it was 2B because of the size. Because mine, believe it or not, and keep in mind here, double A person, I had a 6 centimeter tumor.
Oh wow.
That is 2.5 inches, way down underneath. It was like up on the upper corner, kind of going up under my arm. So very much like your situation, and I was triple negative, which means you're not receptive to any hormones. And just kind of an interesting little side note to sort of, just something I only learned a number of years ago. Through all this is that there are so many different types of breast cancer, and one of the reasons now that we have such high survival rates and such success with it, they used to treat breast cancer the same, just like if you've heard about childhood leukemia. Childhood leukemia survival rate used to be like 15%, like it was a death sentence. Now it's like over 95 for like the most common type. The reason being they used to treat them all the same. And they realized it's not just one cancer, it's many. Same thing with breast cancer. It used to be like a set treatment, like something awful. They used to say like slash, burn, and poison or something. Like you do chemo, radiation, and surgery.
Right.
They would treat everybody the same. And they realized people obviously were not all having the same response. So they looked at the model of what they used for childhood leukemia, and that's actually what they used to treat breast cancer individually, which I thought was really interesting. So there are many, many different types. Mine was triple negative, which means you're not receptive to any hormones, which is can be a good thing and a bad thing. It's an incredibly aggressive type of cancer. It's rare. It's very rare. It's one of the most rare. Now I read things about it now. It's like, it's probably a good thing I didn't read that 12 years ago. And now I kind of understand what about it. My doctors were like so happy every time they come to me, and like when I didn't have any of the mutations associated, which is kind of like a genetic thing, which is a whole other level to it. But now I understand when they came to me and they're like, "Hey, we have really good news." I'm like, "What? I'm done?" And they're like, "No, you don't have any of the BRCA." I'm like, "Okay, great, whatever, fabulous, okay, but I'm still doing what I'm doing."
So basically, the moral to that story is don't Google everything that
Don't,
you have.
do not.
Googling is honestly the worst thing you could do, because the cancer drugs and just everything has come so far. So the things that you're looking at now on the internet are many years old. Right. They are not up to date. Only the most up to date stuff is the stuff that your doctors are having. And so don't, like, that's the worst thing you could do, is A, Google, and B, like, when you do find out, it's not a death sentence anymore.
Exactly. That's
not at all. Even with stage 4, you can be cured.
How many
and
stage
so
4 survivors do we know?
attitude is the number one thing. Attitude. You must stay positive. I'm gonna kick this thing butt. Like, let's go. Let's get through this. I don't know why I have to do this, but we're getting through it.
So mine was triple negative, which is more common in young women. Although Joan London, who you might have heard about, she actually was triple negative. You're seeing a lot of older. It's just one of those weird things. It's a much rarer one. So very much like you, my treatment was the same way because of the size of it. They thought initially they would shrink it first and then do a lumpectomy, which and do a mastectomy. But I had the same kind of response like my first treatment, and I say this and it's kind of creepy. My mom would go with me to every one of my chemotherapy treatments, and I even told her, I'm like, I feel like going through the tumor. I know this is going to sound weird, but I really did. Mm-hmm. And sometimes it would kind of, because mine, when my doctor, the biopsy, they ended up doing in his office. My doctor was actually out of town. I never had one of those experiences where you go in there, you sit down, he tells you what happened. He was out of town. He actually called my mom first. My mom was actually the one who told me.
Oh, wow.
Which was, kind of a cool thing in a way, if you have to have an experience. I mean, we knew something, and my concern was that it was something nobody had ever heard of. It was like, okay, breast cancer. I know people have had that, and that's okay. So, and then I called my doctor that night. We went out to grab dinner. I remember this very distinctly. We went out to pick up takeout, and she told me, and she's like, okay, he wants you to call him. So I call my doctor, Dr. Rimmer, and he tells me, this is the deal. We're going to send you to this oncologist. And I remember asking him, like, well, is this something we've never heard of? Is this something, a year from now? Or how, he's like, I would hope it wouldn't even take that long. But he's like, yes, I've seen this before. And I've seen, I'm like, okay. Not entirely. A year from now, everything was good. We were good, but, a lot more to that story. A lot more surgeries, a lot more stuff down the road. But, so then same kind of thing. We went to the same oncologist, wonderful Dr. McKean, and I saw her. I met her on a Tuesday and started chemo the following Monday. So they don't mess around. Same kind of thing. They said, if you want to wait a week or more or something, that's fine. But anything more than that, you could be looking at a totally different situation.
Yeah, because yours was growing so quickly.
Yeah.
Another week would put you in a different.
Exactly.
So you just touched about the mind space that you need to be in. So what for you, when you got the news, was there an instant, okay, I need to tackle this, or did you have a minute of not remorse, but a minute of feeling self-pity? Like, how did you kind of
I never ever once felt self-pity. I literally was like, I do not know why I got this. There's a reason that I got it, but I'm going to kick this thing's ass. Sorry.
It's all good. I curse all the time.
But I was just like, this is something I have to go through. I don't know why, but it's something I have to go through. And, I just relied on God, and I had my faith. And, one of the Bible verses I always go through is Joshua 1:9. Have I not commanded you? Do not be. Now I'm going to forget it. Have I not commanded you? Be strong and. Why can I do this? Do not be afraid and do not be dismayed, for the Lord your God is with you wherever you go.
Yes.
So I knew he was with me. I knew he was going to take care of me. And then also Joshua 29:13, or 11 through 13. For I know the plans I have for you, plans for welfare and not for evil, to give you a future and a hope. He has a future plan for me. He has hope planned for me.
Yeah.
So I had no reason to fear. I had the wonderful doctors. I had Dr. McKean. Initially, I had a different breast surgeon, but ended up with Dr. Rimmer as well, who did an amazing job.
Yeah.
And
We're so lucky to be where we are. We just have
yes, and the people who I told, some of them actually were more upset about it than I was.
Yeah.
Really?
I know, it's weird, yeah.
Well, that's like, I have a thing that I always tell the girls I work with, and it's God gives us toughest battles to strongest warriors. And that's what I believe, at least for what happened in my life, is because now I can actually help others. And now, for you or for you, maybe it's the fact that, okay, I've been through this,
Right.
and I can show you, and now I can show you how to walk through grace in this.
Yeah. There was a meme recently that I saw that I sent to a friend of mine that actually said, it was the whole thing of God, gives us only what we can handle, and so apparently God thinks I'm a badass.
Yeah.
I love that.
Yeah.
Well, and for me, one of the ironic
that.
things is my friend Sarah, she actually went to 3 of my chemo treatments with me. So she went, walked beside me through the whole journey. And then shortly after I had finished everything, she actually was diagnosed with breast cancer. And I almost feel like I had to go through it sometimes to walk with her through it, because when she got her information, she wasn't scared either, because now she'd already kind of seen it and been there with me and realized that, you know what, I'm gonna get through this too, you know? And so
she's like another model she's finished with everything, and she's very fortunate, had very few side effects, and very few, and it's like, this is exactly what, this should be the norm, and this can be the norm, and this is what people need to see. And
well, what was your thought process on your end? So your mother told you, did you go to any, wow, I can't believe I have to do this, or why is this happening to me, or was it an instant that thought process?
Yeah, it was, very similar kind of thing. It was an instant kind of, you take on that. I apply a lot of things to sports and kind of that athlete mentality, and I go back to this around the time of Lance Armstrong, and regardless of what you think about, don't even get me started on anything related to that, because I don't really care what you freaking have to say about that. If you know what the man has done for cancer survivors, that trumps everything. There was a commercial where they would show, he was, because this guy was as close to dead as you could possibly be, and there was an image of him on one of the Nike commercials of him laying in his hospital bed, totally bald and gaunt, and then he had a bike in his hospital room, and he'd get on that bike and he'd start, true story, riding it, and then they'd show him winning the Tour de France, and I'm like, okay, that's, I always had this idea of, all right, great, this is my chance to make a comeback, and if I'm going to come back, damn, I'm not going to come back the way I was. I'm going to come back even better. I'm going to come back even, and shoot, I was in the best shape of my life then. I'm in even, better shape now, and it's taken, a while to get there. But, kind of that same mentality of just, like you said, I never thought, why. It's funny, a friend of mine, one of my closest friends asked, and I finally eventually told her and got around. I was never shy about telling anybody, but it just, at the same time, it's not something you just pick up the phone and go, oh, by the way, got cancer. So after you
didn't go through your Rolodex and call everybody.
You
didn't post them on Facebook.
Right. You almost kind of think everybody knows, but at the same time, you realize they don't. So then, she kind of knew something was up, and I remember we got together, and when I finally told her, I remember one time she, we were talking online or something, and she said, you must wonder why me, and it was the first time I really thought. I thought, no, I never wondered why me. I wonder why anybody though. Right. It was just kind of that whole idea. It's like, why does he have to go? Just the whole thing. Okay, you go through chemo, you lose your hair, which is, everybody has different connection to their hair. I get that, but trust me, it's your hair, people. It will come back.
It grows back.
It's fine.
And mine grew back twice as thick.
Mine was already super thick to begin with. So look, okay, it's gonna be fine. Life, hair, it's okay. You're gonna get through it. So just all that kind of stuff. And I just would think, what a lame thing. With chemo makes you believe. I understand the biology behind it. It has to do with the cells and how quickly they divide. I get all that, but what a stupid thing, just stupid things. You're like, why is this part of the deal? Why do you have to? So yeah, I had, and I will say, just another side. You talk about, God. So I do have a spiritual connection to it. That's really kind of weird. I had a friend who was clairvoyant of sorts, if you will, that I had seen maybe about a year and a half before. when I was in between jobs and just at a point in my life where I was kind of figure things out, and he was kind of mentoring me, and he was telling me about all the people that were surrounding me, like your guardian angels, which I always thought, I'm like, yeah, always known, I've always been I was always very intuitive. I think it comes from being a Pisces, I'm always very, keen on that kind of stuff. And first he started talking about, and I'm saying nothing, I'm just totally playing along with this, and first he starts talking about, it turns out being my grandmother on my mother's side, and I'm like, he named her name, and first name, Anne, and everything, and I'm like, okay, what's going on here, And then he's telling me there's somebody else, and he says, I'm not sure if it's a relative or a friend, but like a Margaret. I'm going through a Margaret, Margie, something like that. I'm going through like everybody I can think of, great grandmothers or family friends. And I remember I went home, and even when I left with him, we were done with our meeting. He said, "You be sure to ask your family, because this person's going to play a very important role in your life." He's like, I don't, he didn't know exactly why. So I'm like, okay, ask my mom. Nobody could really think of whatever. Totally forgot about it. Fast forward about a year and a half. And with my cancer, they thought that because it was triple negative, and because my dad had melanoma, which can somehow be the way that it kind of like skips generations in men and women, they thought mine might have a genetic basis. And so they're going back through family history and saying, we got nothing other than my dad. My dad never wore a shirt as a kid, grew up on a farm, so that wasn't like anything bizarre that he would have melanoma. But my father did have 3 aunts, so my great aunts, who all died of breast cancer very young. It was all in the same area in Pennsylvania, so I'm sure there's like something weird going on there, and something that was happening. But so my mom and I were talking about this one night, and I remember this. We were standing in our kitchen, and I'm like, did you ever know any of these people? And she's like, I know I only ever knew one. It was the youngest one. She was kind of like the black sheep of the family, which is odd. Gee, I don't know anybody like that. And she goes, yeah, it was Aunt Margaret, or Aunt Margie. And all of a sudden, like, it just dawned on me, and I go, oh my gosh. And she said, what? I'm like, that's it. That's what James is talking about. That's what he told me he was going to play such. And it is kind of gives me chills thinking about it. It is weird. Yeah. Because I did always know, I've always been a person of great faith, and it's just like you said, God's got me through everything. So I always had that, but at the same time, going into everything, I did have this just extra sense of, incredible peace, and I remember I got to go back and tell him that was one of the few times that I just absolutely lost it. I got to tell you, I went back to see him, like, I got to tell you what happened, and I just lost it. I'm like, you were totally right about Aunt Margaret, and so Aunt Margaret definitely was.
Oh, wow.
Been there with me, and I think probably, no question, I think we all have that. We just don't always know who it is or make that connection, but
yeah. So during the so you both lost your hair. So how did that affect as far as self-esteem wise? I know you said you had reconstructive surgery.
I've had 11 surgeries
okay.
total. 10 of them.
Did you have to have reconstructive surgery?
This is how it should be. Yes.
There was initially like I said, I had 2 breast surgeons. My initial breast surgeon actually ended up also getting diagnosed with breast cancer. So
wow. That's
why I had to switch from her to Dr. Rimmer. She was referring her patients to Dr. Rimmer. And initially her diagnosis was lumpectomy, my oncologist, Dr. McKean, lumpectomy. So like that was kind of always in my head.
Yeah.
I never thought about mastectomy at all.
Yeah.
Until I did see Dr. Rimmer, and he's like, well, I actually, we haven't talked very much about gene mutations or anything like that. She touched base on the BRCA1, BRCA2, but now there's, I believe, a panel of 15 that they test for.
Yeah.
Oh, wow.
Yeah. And part of it, I had a gene variant with the PALB2, which is a breast cancer gene, and a pancreatic cancer gene.
Oh, wow.
And with that variation, and I can't say it's a full mutation, it's just a variation because, quite honestly, nobody else has tested for this exact mutation or variant that I have at this time. We keep checking the databases, but right now I'm the only person who has this exact variation.
Oh, wow.
So
look at you.
They don't know.
You're
and
just special and
you have no idea. And
we got black sheep and special.
I'm telling you, man.
And so he's like, well, we're not supposed to take that into consideration because there's no data available on this variation. He's like, I really think you should do at least a single mastectomy. And in my mind, I was like, I'm not doing one.
Right. Exactly.
It's either going to be lumpectomy or all or nothing. I just, it's
Right.
not going to work that way. So, I did pros and cons. I saw people's advice. I went back to the oncologist, Dr. McKean, and I talked to her about it. And she's like, you know, it's really up to you. She's like, I just don't, you know, we've shrinking so much. I really just think a lumpectomy is, you know, and I lost sleep over it. I cried and just, you know, what to do. And once I actually finally made the decision just to do the lumpectomy, my whole, like, you know, I went back to peace and calm and, like, I knew that that was the right decision for me. So I had a lumpectomy and, Dr. Rimmer did it, and I remember being in his office, and usually it's called a keyhole cut, so like it goes like basically like from around the nipple to the side, and because mine was it was actually very far on the side over here. And they do this keyhole cut, and you know, they always show you pictures of everything to see what it might look like after the fact.
Yep.
And because mine was so far over to the side, I just, you know, I asked him, I was like, so there's no way you can cut over here, just on the side? I was like, do I need, like, is the keyhole cut necessary in my situation?
Right.
Not that it's, you know, but I just thought, this is all the way
you
over
don't have
here,
to.
you know, why,
Right.
you know? And he's like, no, keyhole. And I was like, okay, you know, just so I was mentally prepared. Well, I woke up from surgery, and he did not do the keyhole cut. He did it on the side. And I can honestly tell you, you cannot even tell I had surgery. My scars are so tiny. I mean, there's some dimpling, but I mean, that's normal with any surgery. But he made such fine cuts and such a great job. I mean, you can't even tell.
Yeah.
And you said, so you had 11 surgeries.
I did, yes. Should have had just, you had lumpectomy. I mean, mine should have been, typically if you do it with mine, same kind of thing. We were originally thinking lumpectomy. They had just gone to a conference, Dr. McKean and her staff had just gone to a conference where the newest guidelines said that it was over 5 centimeters with triple negative, you should do a mastectomy, which it was a very, I mean, first I jokingly say, I mean, really, it's, you know, and I remember at one point one of her
She's like, no,
nurses
take
came
them and give me new ones, please.
not for nothing. I had thought about it, literally, because I was the kind of person that if I saw a shirt that I wanted to wear, it was like, that's cute. Now, what am I going to have to get from Victoria's Secret in order to make that a reality? And my mom and I would talk about it. She's like, hey, you should really look into it. Because I was. I mean, you're supposed to at least be like, usually you're like a little bigger than your parent, you know, your mother or whatever. I'm like, no. Well, for me, it just, you know, no, I was the person that still wore a push-up bra underneath my sports bras, which I bought in the children's section of Walmart when I played tennis, just so you wouldn't look at me going, hey, you're 30 years old and puberty still doesn't hit yet, huh? So, you know, I mean, you know, and hey, if you're gonna have it done, please don't go about it this way. But at the same time, if you can get insurance to pay for it, why not? You know?
Hey, I'm all for it.
Should have been. So they just come to that real, and I didn't want to spend the rest of my life going, oh my God, what's that? What am I? You know, no, very easy decision, and I'm totally comfortable with it. But what I was going to say that was funny is that one of my wonderful nurses, who was really my nurse navigator and like my greatest cheerleader through the whole thing, that I could like email anytime, be like, oh, I'm feeling this way today. Great, that's exactly how you should be feeling. Okay, fabulous. All right, wonderful. So that's great that I'm feeling really weird. Well, awesome. But, you know, she came to me at one point before my surgery and said, you know, we haven't talked about, are you okay with losing your breast? You know, we haven't. And I just literally, it was all I could do. I had to like bite my tongue. I'm like, man, there's not really much to lose here. You guys know me. And she just kind of walked away and laughed to herself. She's like, okay, just want to make sure you're good with it. I'm like, yep, no worries with that, you know, which I understand. That's a thing for people. That's a very personal decision. And, you know, like you see, you thought about it very much. You have to weigh all your options. For me, it was all the recommendation, and it was very simple. I didn't want to spend the rest of my life going, oh, what's this? And so now, with the way mastectomies work, it used to be a much bigger deal. I truthfully can say it's not a difficult surgery. They put in what's called tissue expanders, and like in the case of if you're going to go a little larger than you, it's like this space age. It's really quite funny. Talk about the funny things that happen. You go and they gradually inflate them. They fill them more, and then they fill them a little beyond where you're going to be. That's kind of painful. And then
it's stretching your
skin. That's what you want to do. So it takes a number of weeks. Once you've kind of healed initially, they fill them up a little bit initially, and then you go every week and they fill them up a little more, and then you wait a couple months, and then you have the implants in, and then that should be it. You should be done. And that for most people is end of story. Mine was just a little more complicated than that. I had about a year or so, actually, I guess it was 2010, so technically 3 years after my diagnosis. Imagine this, so you have this, aggressive, complex cancer, everything's great, you go through treatment, chemo works amazing, you're in the clinic. It's triple negative, too. It's a little different. The whole, time frame of it is different. Like our 3-year mark is the equivalent to most 5-year mark, and our 8 years is kind of like the equivalent to 10 years. Like they watch you like a hawk for like a year or two, and I was having scans all 3 months and then 4 months, and then you're still having PET scans, and of course all the blood work and all that, and any little thing. And with scans, the biggest thing is your body changes all the time, so there's always going to be something. So everybody goes through that, like, well, we see this thing. And like, what do you mean you see this thing? And even, that was like one time, even for somebody like me that's so easygoing. And so, I literally would put my life on hold for like 3 months. And it's, for like a week, every 3 months, like, okay. Like I remember one time I was supposed to go on a business trip, and I just said, I didn't book it. It's like, why didn't you haven't booked your flight? Why haven't you booked your flight? Well, just got to make sure things are good. Yeah, that was a very, I will say, stressful time. So, imagine going through all that. Everything's great. You get to the 3-year mark where they're really like, kind of breathe. And when your doctor says that, Dr. Keene says that, you're like, okay, great. And then all of a sudden I had like this kind of virus or something, like a sort of just kind of flu thing, got a fever. And I would always have this little spot on my incision that was, Dr. McKee used to always say it was a stitch. And I'm like, oh, it's not a stitch. It's not, and I'd ask my plastic surgeon about it, who, thank God, I ended up with Dr. Lee, wonderful plastic surgeon that I ended up with, because he had been a trauma plastic surgeon previously, and then went into cosmetic and does so much cancer work, especially breast cancer. And we would end up going through 8 surgeries together. I had an infection that was ultimately a bacteria caused by radiation, which sometimes doesn't show up. I talked to a doctor, friends of mine, it can show up like 10 years down the road. Mine, came across pretty early, but basically I had a 50-cent piece size hole. And I would be looking at the implant going, I had this kind of virus, and then it started to ooze, and I'm like, this isn't good. And I immediately go to my radiologist, and he's like, that's a surgical thing. And of course you were thinking, oh my God, is there a recurrence? Is there something? And they're like, Dr. McKee, but like, no, this is just a surgical problem. So I go back to my plastic surgeon, and he's like, yeah. All right, so yeah, we're gonna have to fix that. Okay, great. How do we do that? Well, we do a lat flap. Okay, a latissimus dorsi flap. I'm going, all right, so is this a big deal? Is it? Oh yeah, this is about 5-6 hour surgery. Well, my first surgery was about 6 hours long, so I'm like, all right, and I start looking into this, and they basically take your latissimus dorsi muscle, which is the long muscle that runs on either side of your spine, which is used to, as I found out, reconstruct a gazillion different parts of your body. It's amazing what they can do with it, and they kind of take that, and they basically took all of mine, and they kind of flip it, and then bring it around the front and create a whole new chest wall. And I will say, going into that, very successful surgery, works great. And of course, being really athletic, that was my concern. Can you still, you're taking half my muscle on my back. Am I going to walk around like this? And unless you were like a professional mountain climber, alpine skier, I'm like, okay, there are plenty of people who play tennis and did CrossFit and all that kind of stuff. So I'm like, all right, cool, let's, run with this. But I will say, when I woke up in the hospital after that, even that was a little bit more. That was one of those times where I went, okay, God, what did I get myself into?
First time I consciously very, very, very painful.
And that's one of the reasons I did not want to do a mastectomy, is because I would have had to have that done. Mm-hmm. And I love CrossFit too. Yeah, I loved CrossFit way too much that it would have just set me back.
Yeah.
So much.
It's a good 8 week, at least. I remember asking, why you didn't ask these questions, but I'm like, oh, it's painful. Dr. Lee tells me, he says, a lot of people say it's kind of like a really bad sunburn. Now, and this is a legitimate explanation, and they never want to freak you out. Yes, so I like to say yes, like a sunburn, if by that you mean someone were to rip the skin off your back, douse you with gasoline, and then light a match. That kind of sunburn, yes, that's kind of. Yeah. So
thanks for reaffirming that I'm glad I didn't get that surgery.
Yeah. But I will say, when you're healed, and I just wanted, before tissue expanders, that's the way they did have to do it. Like you said, sometimes people do still have it. It is a great procedure.
It is, and actually, I did research it when I was looking into it, and there are actual CrossFitters who have been through breast cancer, who have had the lat flap surgery, and get back to it. And amazing, they're also in their 20s, right. Which is another thing as well.
Yeah. And I do notice difference. I've had some great trainers who have really helped me, because I would say automatically, we do lat exercise. I'm like, oh, well, I don't have one on this side. And they're like, it doesn't matter. You just have to learn to train the other muscles. Right. And that's been a whole, experience of compensating. And so, so I had the lat flap, and then as one can imagine, when you've done a lot more to one side than the other, you don't know until swelling goes down and all that how things are gonna level
Settle
out.
down.
So there's a lot of adjustments that have to be made, and so it was really kind of just a matter of that. And then about 10 years ago, about 2-3 years ago, I had them switched out. I just kind of had the incisions redone.
So was that out of your choice or switched out because?
Well, about 10 years can be about a normal lifespan, and of course implants are changing all the time. I originally had saline, and because silicone at the time wasn't as good, now they have the gummy bear silicone that's more like a solid piece, so it's not going to leak, and you don't have to worry about all the issues that we've had in the past with that. Also, in my case, and this is another whole other topic and something I'm adamant about, especially for anybody who's really athletic, a lot of friends I talk to now, if they're getting ready to have a mastectomy, there's this whole thing of whether you put the implants on top of or under the pectoral muscle. And back when I originally had my mastectomy, it was just standard practice, put it underneath, because then you have that pectoral muscle as, tissue.
Right.
And then, of course, when you have a lat flap, though, and it wears, the tissue erodes, I remember looking at that going, wait a minute, didn't you put this under the muscle? Why am I seeing the implant? Well, it eroded. Okay, that doesn't sound like a good, it's the infection. So I was kind of like, one basically was on top for lack of, the pectoral muscle not being there. The other one was, so I had this thing which a lot of people, when you do it under the muscle, will have, where the side that I did not have cancer on was like feeling like it was going to end up under my armpit, And not only does that look odd, it feels odd. It's very, so I had a surgeon in Orlando that I had actually had taken care of a lymphedema issue for, totally a side effect, which I can talk about later, another side effect of cancer treatment. Who mentioned, when I mentioned to him, and he did such an incredible job with the scars and everything, I said, hey, can you kind of clean up this side? This is kind of pooling. And then he was the first one to really explain to me that it's because I'm basically like this, my right side was underneath that pec muscle and was pulling this way. So now they've started, he was the first one to tell me, especially in young, really athletic people, he almost always puts them on top because you don't have that. I was like, wow, okay, well, that would be fantastic. And so now I've had that done, and I can't even imagine doing the things that I did, especially weights-wise. I mean, I couldn't lay flat on the floor, and you just felt like your chest was going to rip open, and you just always felt like you had if somebody took a tarp and wrapped it around you. I mean, that feeling never left, and I know a lot of people complain about that, and you have to use some more artificial tissue, but now there's really good artificial tissue, alloderm and that type of thing, so I am adamant about put them on top. I mean, obviously, it all depends on your particular situation. There's a lot of things you have to take into consideration, but having had it both ways, there's no comparison.
Wow. So, as far as the recovery process and, and now that you're, healthy, and so do you kind of have any trepidation when you go into your doctor's office? Like, what am I going to find? Or now that you're in remission, is there anything that you...
I personally don't. When I met Kelly at the Young Women's group that they used to have, there were several women in there who just had this major fear.
It's like a PTSD kind of thing.
Of their breast cancer coming back. And I don't have that fear. I mean, maybe because I feel like I literally had the easiest route.
Right.
I didn't have a lot of complications. Granted, I had the best team. They set up the plan, we followed the plan, everything worked. Even with the chemo drugs, I never got sick. I ate like a pig. I gained 18 pounds. And, whereas other people I know lost their appetite, they got really sick. And it all depends on, how your body reacts to the drugs.
Sure.
And so I had, mentioned my friend Sarah previously. Sarah and I had the opportunity, while she was on the exact same drug regimen as I was, as far as the types of drugs, the amount. So I got Decadron, a lot of Decadron, which Decadron is a steroid that makes you eat.
Right.
Now, while she had Decadron, she didn't have the amount that I had. So she was nauseous and things like that. She didn't get sick, but she wasn't starving like I was. I mean, I couldn't eat enough. And as a joke, as a CrossFitter, we eat a lot. And so Derek, our coach at CrossFit, would be like, oh, still got that CrossFit appetite. And I'm like, yes, but I'm not working out.
Yeah.
And I'm not sure cookies counts as a CrossFit diet. because that's another thing is the chemo drugs, mess with your taste buds. So, some things tasted really good, cookies. Other things didn't taste so good.
Just so you know, it tastes really good anytime. You don't have to be.
And the other bad thing though is sugar. Sugar feeds cancer.
Right.
So that's like literally the worst thing I could be eating while I was going through chemo treatments, but still did it anyway. But I am happy to say, prior to Thanksgiving, because I ate a lot of Thanksgiving, I lost my 18 pounds of cancer weight.
Yeah, see?
Thank you. Thank you, CrossFit.
Yes.
And a good
Thanks, Derek.
And a good diet.
Yeah.
So, last kind of wrap up question. So I feel from just listening to you ladies, not only is it the mindset that you go into it, but for you talked about having God and the way that you looked at the outcome, and you say you don't have like that PTSD mentality when you're going into your doctor's visits, and from what I'm hearing is also because you give it over to him, like that no matter what, this is the path that you need to follow, carry, get through with his help and guidance. What would you say would be like one last thing that we can give hope to women who either are going through this or may come upon this? What would you say?
The only thing I could really just reiterate is stay positive, because if you say you're gonna die, you're gonna die.
Right.
But if you say I'm gonna kick this thing's ass, you're gonna kick this thing's ass. And there's gonna be times you're gonna be like, oh, am I sure I can kick this thing's ass?
Mm-hmm.
Yes, you can.
Yeah.
You just have to remember he's got you. If he brought you to it, he'll get you through it.
I love that.
Oh, and my other thing that I forgot to mention was when when you had mentioned, like, people would be like, why do you think this happened to you? Why this? Why that?
Yeah.
I came up with my own little saying. I don't ask why, I just win.
Oh, I like that.
Yeah.
Yeah, awesome.
So you win.
Absolutely.
Don't ask why, just win. Just kick its butt.
Yep. I would agree. I was last year. I was one of the Komen Warriors in Pink. They always select 8 women, 8 because of 1 in 8 women are diagnosed of 1 in 8 women in their lifetime, diagnosed with breast cancer. That's kind of the average, and so they were picking women locally here in Palm Beach County, and I was one of them. And you answer this very lengthy questionnaire, and you explain the whole story, and they end up doing a poster of you with a quote, and you never really know what that's going to be. They don't really, which is probably wise, because they'd have to you can imagine a gazillion revisions if you're asking people about it. So you don't know what that's going to be until they do it. And, I always talk about, I talked about how I kind of carry the flag for young survivors, because there's a lot of issues that obviously apply to us as younger women that aren't the same if you're in your 50s or 60s. But part of what I said, and I talk about this a lot when I do speeches and mentor people, and this is actually the quote that they picked, which was just kind of funny, but I'm like, well, that's me, that's what I would say, is, something to the extent of, you're on this journey, you're going to, find a person on the other side of this journey that will blow your mind, the most kick-ass version of yourself that you ever imagined. And it's true. I mean, you are. Yeah, it's an old saying, you don't know how strong you are until you have to be strong or whatever, and yeah, I mean, you're going to get through it. You have to find whatever works for you, whatever is motivating to you. I mean, yes, for me, it's for you. The whole idea of hand it over to God, and you're going to get through it. But just to know that it's not a death sentence, like you said, to have that positive mindset, I firmly believe that makes all the difference in the world, because I've known people who have not been as positive and doing great and are in remission as well, but went through a much harder time because they constantly, and yes, it's easy to be overcome with that worry and that fear. And you talk about, PTSD, which is so real in cancer survivors, and it's only now trying to get, starting to get a lot more attention, but I'm the same way. I mean, I go back to now I'm down to annual visits, which is super exciting. And you get there, and it's kind of like, oh, you get to see all your doctors really do become family. But I will still catch myself sometimes even sitting in the waiting room, and you're there, and you're like, why on earth am I kind of nervous? Because that still comes back to you. The part of that is always there. So, but just to realize that, and think of what you're going to get out of this. This is your like a, and I said in my case, this is your chance to make a comeback. This is your chance to, prove everybody wrong. Look at it that way, because there's always people out there thinking, oh, well, now you got this one.
And the other thing I would say is, find that one thing that pushes you to want to live.
Right.
Yeah.
You know, so, you know, for some people it might be their kids, you know,
Right,
who have,
right.
you know, for a woman who's married or
Yeah.
even a single mom or whatever, you know, it might be your kids, could be your dog, you know, it could
Yeah,
be your pet
exactly.
or whatever. For me, I'm not gonna lie, it was CrossFit. I loved working out at the CrossFit Squad so much, like I couldn't wait to get back,
Right.
you know.
So that was your motivator.
It really was, and you know, it's really hard to work out when you have chemo, but I made it to the gym, I think like 5 times during my treatments, but even just going there and being around people, even though I could barely do anything, it just, you know, it helped me to be like, okay, I gotta get back to this,
And that kind of brings, like, for me, my takeaway to this was in what I do and then the people that I connect with, it's a matter of a community. Like, whatever it is that you're struggling with, like it could be recovery, it could be cancer, it could be, you know, an eating disorder, but you find a like-minded people or find people that have been through the same thing, whether it's your church, you know what I mean? So if you don't believe in God, you're not going to go to church for that community, but you can go to CrossFit. For me, this was, you know, the gym here. I met a lot of people here that helped me, and just.
And it's amazing too. I mean, I found just kind of individually there weren't a lot of, especially like young survivor groups 12 years ago. The group that Eric and I met through, that was like 2 years ago. I think I was at like 10 years out, and one of my practitioners at December King's office. Yeah, there you go. You know, she told me you have to go to this, and I was like, and you're kind of thinking, all right, I've really never gone. I'm 10 years out now. What do I? And she was largely telling me because of, you know, she said, hey, it's going to be great for these young women to see somebody that's already 10 years out. But and she would tell me, and she's like, I don't think you realize how much this is really going to impact you. And now I tell the story. I walked into a room full of women for the first time in my life. I saw all these women who all looked exactly like me, you know, in terms of being at that stage in their life. All these people I could relate to. We're all, you know, okay, some are married, some have kids, but we're all like, you know, in the same stage of our lives. We're like, you know, young professionals and whatnot, and have the same concerns. And it was life changing.
Yep.
Even that far out, because, you know, that's another thing is that it's not like you're just diagnosed with cancer, you're treated, okay, now we're done with everything.
Oh no.
There are still so many things that both of us deal with, so many things medically, other, you know, physically, spiritually, mentally, whatever, that still impact you. And that's another big point that I make, is it's not, you know, just like you talk about recovery, it's not like, oh, okay, oh, great, well, you're sober now you don't have anything to worry about, you know? It's like, not quite, you know? So it's an ongoing process, it's a journey. And, you know, I like to say, take only what you need from it. You know, leave the bad stuff behind, leave all the crap behind, take all there's going to be so much good you're going to pull out of it, and take that with you.
And you're going to be able to carry that to other people too. Like just this message alone, you're going to be able to help other women who are struggling. And one of my other podcasts was about breast implant